Good day, everyone. My name is Dr. Rosemarie Rohatgi. I'm a local Rancho Santa Fe Covenant resident. I've been practicing for over 23 years, and my entire practice is focused on sleep medicine. I'm the founder and owner of San Diego Sleep Therapy, and you can find me on the web at sandiegosleeptherapy.com. I'm here today to discuss how to sleep better through COVID-19 pandemic. A little bit more about me. Again, I'm Dr. Rosemarie Rohatgi. Most people know me as Dr. Rose. I'm triple boarded in sleep. I was elected this year as board of director with the American Academy of Dental Sleep Medicine, which is a national professional organization. I've authored several papers in the Journal of Dental Sleep Medicine. My office was recently recognized as 3 Best Rated, which is an independent company that uses a 50-point inspection, which includes everything from checking reputation, history, complaints, ratings, satisfaction, trust, and cost to the general excellence. I'm also currently a board of director of the Rancho Santa Fe Community Center. So what is the optimum number of hours of sleep that adults should get? What is that magic number? Medical evidence suggests that for optimum health and function, the average adult should get between 7 to 9 hours of sleep daily. But more than 60% of women regularly fall short of that goal. And unfortunately, we don't get any monthly reminders that we've fallen behind. In fact, the greater the sleep debt, the less capable we are of recognizing it. And once sleep deprivation with its fuzzy headedness, irritability, and fatigue has us all in its sway, we can hardly recall what it's like to be fully rested. And as the sleep debt mounts, the health consequences increase, putting us at growing risk for weight gain, diabetes, heart disease, stroke, and even memory loss. I love this slide because what it shows me is on the left side is actually, I couldn't quite get the entire slide to fit. It's the number of hours that you need for sleep. But here in the middle dark blue area is the recommended number of hours of sleep. The teal color is maybe appropriate hours of sleep, and the yellow is not recommended. So you can see here for adults 7 to 9, even older adults 65 and over, about maybe 7 to 8 hours of sleep. What is sleep debt? Sleep debt is the difference between the amount of sleep you need and the amount you actually get. And why do we need sleep? Well, sleep doesn't trump food and water in the hierarchy of physical needs, but we can't live without it. So too often we regard sleep as an indulgence of luxury. Rather, we should recognize that adequate sleep is just as important for health as diet and exercise are. In a landmark study of human sleep deprivation at the University of Chicago, researchers followed a group of student volunteers who slept only 4 hours nightly for 6 consecutive days, and the volunteers' outcome developed higher blood pressure, higher levels of stress hormone cortisol, produced only half the usual number of antibodies to a flu vaccine, showed metabolic slowdown, and also signs of insulin resistance, which is a condition that is the precursor of type 2 diabetes. And all of the changes were reversed when the students made up the hours of sleep they had lost. So the Chicago research helps to explain why chronic sleep debt raises the risk of obesity, heart disease, stroke, and diabetes. You should only use your bed for 2 things. And what are those 2 things? The bed is for sleeping and having sex, and that's it. If you suffer from insomnia, do not balance the checkbook, study, or make phone calls while in bed or even in the bedroom, and avoid watching television or listening to the radio. All of these activities can increase alertness and make it difficult to fall asleep. Create a sleep sanctuary. You should reserve it for sleep, intimacy, and other restful activities like pleasure reading and meditation. Keep it on the cool side. Banish the television, computer, BlackBerry, and other diversions from that space. So 10 tips to avoid sleep deprivation. You want to wake up at the same time each day. It is tempting to sleep late on the weekends, especially if you had poor sleep during the week. However, if you suffer from insomnia, you should get up at the same time every day in order to train your body to wake up at a consistent time. Eliminate alcohol and stimulants like nicotine and caffeine. The effects of caffeine can last for several hours, perhaps up to 24 hours, so the chances of it affecting sleep are significant. Caffeine may not only cause difficulty initiating sleep, but it may also cause frequent awakenings. Alcohol may have a sedative effect for the first few hours following consumption, but it can then lead to frequent arousals and a non-restful night's sleep. So avoid caffeine after noon and go light on the alcohol. If you're on medications that act as stimulants, such as decongestants and asthma inhalers, you should ask your doctor when they should best be taken to help minimize any effect on sleep. You also want to limit your naps. While napping seems like a proper way to catch up on missing sleep, it is not always so. Nap only when it's necessary. Night owls and shift workers are at the greatest risk for sleep debt. Napping an hour or two at the peak of sleepiness in the afternoon can help to supplement hours missed at night. But naps can also interfere with your ability to sleep at night and throw your sleep schedule into disarray. So it is important to establish and maintain a regular sleep pattern and train oneself to associate sleep with cues like darkness and a consistent bedtime. Napping can affect the quality of nighttime sleep. You also want to exercise regularly. Regular exercise can improve sleep quality and duration of sleep. However, exercising immediately before bedtime can have a stimulant effect on the body and should be avoided. Try to finish exercising at least 3 hours before you plan to retire for the night. Get regular exercise, but just not within the 3 hours of bedtime. Do not eat or drink right before going to bed. Eating a late dinner or snacking before going to bed can activate the digestive system and keep you up. So if you suffer from GERD, gastroesophageal reflux, or heartburn, it is even more important to avoid eating and drinking right before bed, since this can make your symptoms worse. Also, drinking a lot of fluids prior to bed can overwhelm the bladder, requiring frequent visits to the bathroom. That can disturb your sleep as well. Your bed should feel comfortable, and if you have a pet that sleeps in the room with you, consider having the pet sleep somewhere else if it tends to make noise in the night. Get all of your worrying over before you go to bed. Quiet your busy brain before you go to bed. If you find you lay in bed thinking about tomorrow, consider setting aside a period of time, perhaps after dinner, to review the day and to make plans for the next day. The goal is to avoid doing things while trying to fall asleep. It's useful to make a list of work-related tasks for the next day before leaving work. That at least eliminates one of the set of concerns. Also, try reducing stress. There are a number of relaxation therapies and stress reduction methods you want to try to relax the mind and the body before going to bed. And some of these examples include progressive muscle relaxation, perhaps with audio tapes, deep breathing techniques. You can also do yoga, meditation, and biofeedback. Lastly, you may consider participating in CBTI, which is Cognitive Behavioral Therapy Insomnia. Cognitive therapy helps some people with insomnia identify and correct inappropriate thoughts and beliefs that may contribute to insomnia. In addition, cognitive therapy can give you the proper information about sleep norms, age-related sleep changes, and help set reasonable sleep goals, among other things. So what's the best temperature for sleep? The best temperature for sleep is between 60 to 67 degrees. Daylight savings. Who was the president that signed the Uniform Time Act into law, and what year? That president was President Lyndon Johnson in 1966. 2014 study by the University of Colorado Boulder shows a spike in fatal automobile collisions during the 6 days following the shift during a daylight savings period. Data from Canada's Matanobi Public Insurance in 2014 showed a 20% increase in crashes on the Monday following the start of daylight savings time, compared to all other Mondays in 2014. However, the small sample size of the study and lack of information about other variables such as weather makes it a little hard to draw concrete conclusions from the Canadian study, but I did think it was interesting to find the spike in fatal automobile accidents. Snoring. What is snoring? Snoring is the vibration of the respiratory structures and the resulting sound due to obstructed air movement during breathing while sleeping. So in some cases, the sound may be soft, but in most cases, it can be loud and unpleasant, and most likely affect the sleep of others. In some cases, the sound can be soft, but in most cases, it can be loud and unpleasant. And snoring may be a sign of obstructive sleep apnea. So what causes snoring? There's several issues that can cause snoring. First, poor muscle tone in the throat and tongue. So the throat and tongue muscles can be too relaxed, which allows them to collapse and fall back into the airway. This is a result from deep sleep, alcohol consumption, or even the use of some sleeping pills. Normal aging causes further relaxation of these muscles. Also, bulky throat tissue. Being overweight can cause bulky throat tissue, and also children with large tonsils and adenoids often snore. Long, soft palate and/or uvula causes snoring as well. So the dangling tissue in the back of the mouth can narrow the opening from the nose to the throat. When these structures vibrate and bump against one another and the airway becomes obstructed, causing snoring. Health risks associated with snoring and sleep apnea. Habitual snoring can be a sign of serious health problems, including obstructive sleep apnea. And sleep apnea creates several problems, and these include the following. Interruptions of breathing, so lasting from a few seconds to minutes during sleep caused by partial or total obstruction or blockage of the airway. Frequent waking from sleep, even though you may not realize it. Light sleeping. You can wake up so many times a night, which interferes with the normal pattern of sleep. And this causes more time to be spent in light sleep more than restorative, deeper sleep. You can have strain on the heart, which is prolonged suffering from obstructive sleep apnea, which often results in higher blood pressure and may cause enlargement of the heart, with higher risks of heart attack and stroke. Poor night's sleep. This leads to drowsiness during the day, excessive daytime sleepiness or EDS, and it can also interfere with your quality of life and increase risks for car and work accidents. What are the symptoms for sleep apnea? So I've made a list of symptoms here, which includes sore or dry throat, loud snoring, occasionally waking up with a choking or gasping sensation, sleepiness or lack of energy during the day, sleepiness while driving, morning headaches, restless sleep, forgetfulness, mood changes, and a decreased interest in sex, recurrent awakenings, or insomnia. Who is at risk for sleep apnea? Sleep apnea can affect anyone at any age, even children. And risk factors for sleep apnea include if you're a male, overweight, over age 40, large neck size of 17 inches or greater in men, 16 inches or greater in women, large tonsils, large tongue, or a small jawbone, a family history. And also nasal obstruction due to deviated septum, allergies, or sinus problems. What are the effects of sleep apnea? Well, if left untreated, sleep apnea can increase the risk of health problems, including high blood pressure, stroke, heart failure, irregular heartbeats, heart attacks, diabetes, depression, worsening of ADHD, and also headaches. Untreated sleep apnea may be responsible for poor performance in everyday activities such as work and school, motor vehicle crashes, and academic underachievement in children and adolescents. 6 ways sleep apnea can hurt your health. Number 1 is high blood pressure. If you already have it, sleep apnea can make it worse. When you wake up often during the night, your body gets stressed, and that makes your hormone systems go into overdrive, which boosts your blood pressure levels. Also, the level of oxygen in your blood drops when you can't breathe well, which may also add to the problem. Treatment can make a difference though. Some people with high blood pressure who get help for sleep apnea will see their blood pressure improve. Their primary care doctor may be able to cut back on their blood pressure medication. But keep in mind, you shouldn't stop or change your dose without talking to your doctor first. Second, heart disease. People with obstructive sleep apnea, or OSA, are more likely to have heart attacks. The causes may be low oxygen or the stress of waking up often. Strokes and atrial fibrillation, which is a fast and fluttering heartbeat, are also linked with the condition. And sleep apnea disrupts how your body takes in oxygen, which makes it hard for your brain to control how blood flows in the arteries and the brain itself. Number 3 is type 2 diabetes. 80% or more of them may have obstructive sleep apnea. Obesity raises a person's risk for both disorders, although studies haven't shown a cause and effect link between sleep apnea and type 2 diabetes. Not getting enough sleep can keep your body from using insulin properly, which leads to diabetes. Number 4 is weight. Extra pounds raise your chances of getting sleep apnea, and the condition also makes it harder to slim down. When you're overweight, you can have fatty deposits in your neck that block breathing at night. But on the flip side, sleep apnea can make your body release more of the hormone ghrelin, which makes you crave carbs and sweets. And when you're tired all the time, you may not be able to turn the food you eat into energy as efficiently, which can lead to weight gain. But the good news is that treatment for OSA can make you feel better with more energy for exercise and other activities. This can help you lose weight, which can help your sleep apnea. 5 is acid reflux. There's no proof that sleep apnea causes this kind of heartburn, but many people say it's a problem. So treating reflux seems to improve apnea symptoms for some people, and treating OSA helps symptoms of reflux. Lastly is car accidents. When you feel groggy, you raise your risk of falling asleep at the wheel. People with sleep apnea are up to 5 times more likely than normal sleepers to have traffic accidents. Treatment for sleep apnea. There are mainly 3 treatments for sleep apnea. CPAP, continuous positive air pressure. Oral appliance therapy, which is a custom-fitted oral device that is small and efficient, easy to wear, and you can travel with without having to use electricity or worry about depending on a humidifier. So it's a very small and effective means of treating sleep apnea. And the last is surgery, such as MMA, mandibular maxillary advancement surgery, and also there's nerve stimulators to keep the airway open. This is really simplifying the treatment process, but I thought I'd outline the 3 main treatments. And we specialize at my office with oral appliance therapy. One treatment that I do want to discuss also for insomnia or pain is CBD. And we carry a certain CBD in our office, which is called New Leaf. You can find it on our website at sandiegosleeptherapy.com under the tab CBD oil. And I have tried probably over 20 different types of CBD, and this seems to be the only CBD that seems to work for not only myself and my staff, but also many of my patients. So if you're interested in CBD oil, again, there's no high associated with it, and it's very natural therapy for insomnia, for pain, chronic pain, among a list of other things. Please let us know and contact us. I do want to thank you for your time, and I want to give a special thanks to the Rancho Santa Fe Senior Center, to Lizzie and Terry. You can reach me, Dr. Rose, at sandiegosleeptherapy.com, and our phone number is here, 858-617-0660. You can get more information on my website. And lastly, I just want to remind you, please remember to vote. The ballots are out and mailed to everyone on October 3rd. And I'd appreciate it if you would check out my website at roseforrsf.com. Thank you and have a great day.